15.2 Physiological and Psychological Responses to Common Injuries by Spike Elizabeth Higgs. So, there are 5 main responses to physiological responses to injuries. These are pain, swelling, redness, heat, and a reduced range of movement. With strains, with muscle strains, it's muscle-based, and there are 3 grades. There's grade 1, 2, and 3. Grade 1 is a sharp pain, but the individual who has this injury, or the grade 1 strain, they can't continue. There's a localized tenderness and pain where it's only around the area that has been strained. There's minimal loss of strength, so there's still the majority of use in the muscle, and the range of movement is hardly affected. So this is around less than 10% of the muscle fiber. Less than 10% of the muscle fiber is disrupted. And these are tears, pulls, or stretches. With sprains, these are joints and ligaments based, and again, there's three grades. So it's a stretch or tear of the ligament caused by a trauma that's like a fall or a twist, so it's overstretching a joint. Grade 1 is there's a little tearing in the ligament, in the ligament. There's a bit of pain and swelling, but the stability is still good. Grade 2 has like the broadest range of damage, and it causes a moderate instability and moderate to severe pain. There's also a lot of swelling, and this means that the individual can't continue. Grade 3 is a rupture. It's completely unstable. There's severe pain, swelling, and often other tissues are damaged. So this is the the worst one, where the ligament completely snaps and it's completely detached from the bone. Hematomas, there are 2 different types, inter and intramuscular. Inter and intramuscular. Intermuscular is within like the compartment of the muscle, so it doesn't seep out into surrounding tissues. But intra goes into the surrounding tissues, so it seeps into it, and this is like other muscles. If you were to have an intramuscular hematoma in, say, your thigh and maybe your hamstring, the blood that seeps, it would go into your calf and maybe up into your gluteals. Next is the blood clotting mechanism. Initially, platelets are activated by chemical reactions, and they stick together. They cause the clot and stick to the surface of the blood vessels, so it covers up the tear and covers up the tear. So platelets plug this. The clotting fractures then will then attach and reinforce it. Fibrin will act as like a glue to stick it all together, and other cells such as red and white blood cells will support this and make it a lot stronger. Next is the stages of healing. Initially, so it's the 3 stages are inflammation, repair, and remodeling. The first one, it says on the graph here, it's 4 to 6 days, so it can be around anywhere up to a week, depending on how bad it is. It can go over, but usually it's up to around a week. For repair, it can go up to 6 months, even though it says up to 24 days here, depending on the severity of the injury. If it's as bad as it could possibly get, then it can be up to 6 months to repair. And then it can be from anywhere from that 6 months up to possibly 2 years to remodel. So when it inflames when the injury occurs, and up to a week. That is the repair stage, where everything is repairing all of the muscle. If it's muscle based, then the muscle fibers will be repairing. If it's joint based, then the ligaments will be repairing and everything, and they'll all be connected together. It will be weak initially, and that's where the remodeling comes in. So the remodeling is then obviously up from 6 months to 2 years, and this then means that this rebuilds and obviously remodels. It rebuilds the muscle to what it used to be before the injury. So with repair, it's repairing the ability of the muscle, but remodeling is then when it brings back what it was like, the area was like before the injury. Next are the 5 stages of grief. This is denial, anger, bargaining, depression, and acceptance. Denial is essentially just not accepting the injury. It's a defense mechanism, and it buffers the shock. So instead of initially just admitting that that the injury is there and everything, you'll deny it. So it might not be that bad. It might not, and it's that it might not that is denying it. It will carry the individual through the first wave of the pain, and then it will get into anger. So once the denial passes, they're not ready for the reality of the injury. So it can be directed at anything. They can be angry at anything, like the surrounding objects, people, family members, friends, parts of the team that they're on. But rationally, they know that it's not justified. Like, they know that it's not actually their fault, but they're just angry in general, so they can't help but be angry towards the others. Next is bargaining. So this is where if only came in. So if only I didn't train so hard, if only I didn't do this, if only I didn't do that. And it's usually because an individual will need to feel that they're regaining control. So if only I'd done this, then they know what they should have been doing, or they know what they did wrong, they know what they should be doing. And so it's like, maybe if I strap it up, it'll be fine. If it's an injury to them, like a joint, or you can use the tape, and if I strap it up, it should be fine. Like, it can't be that bad. So they feel that they can then take control of what's happening, and they can still benefit from, or they can still play, or they can still benefit the team. Then there's depression. So it's realizing and understanding the consequences of the injury. So an individual can feel isolated when they're away from the team, and they'd have difficulty adjusting and accepting. So they can't accept that maybe they're injured. They can't adjust to how they're going to be away from the team, how they're going to be training, and they'll have difficulty adjusting to this. So they can't. Then they're training by themselves. They're with their own team they're with their own team to rehabilitate them, instead of being with the normal team, with everyone there with, say a basketball player or a football player. They're usually with the full team. They're going to be training. They'll be training, if anything, they'll be training with the players in the same position. So to be away from them and just be with a rehab team would be completely different. Then last is acceptance. It's where the athlete will accept that they are injured, and they start to move towards maybe adapting to the injury. So instead of focusing on the downsides of it, instead of focusing on the downsides, their focus turns to rehabilitating, and it goes from all denial, anger, bargaining, depression, those all emotional sides of it, and they go into coping, and they realise what needs to be done to be treated to come out of this perfectly fine. Next is the 9 emotions. The 9 emotions of the emotional states of mind. This is depression, and depression will come around the treatment phase. Obviously, as I just said, they'll be away from what they're used to, and they can't look at any upsides because they're away and they can't see anything happening. Next is anger, and that's around the time of the injury and reflecting on what they did. So they would be angry when, I'll say, a footballer recently, James McCarthy, who had both of the bones in his leg snapped by another player just kicking his leg, and obviously you'd be angry at that because, well, he's broken his leg, he can't play, he's come back from an injury recently, and he's going to be out for easily a year with that injury. So he'd definitely be angry at that, and especially reflecting where I could have done this differently, and that would have been fine, I wouldn't be in this position. And then that leads to frustration. So around the time of the injury and afterwards, like between getting injured, when they're diagnosed, and through into training, where they're frustrated at the fact that they have to do this instead of, or they're frustrated that it had to be them. Then anxiety, so it's around the diagnosis and the end of the treatment, so you're not sure how bad the injury is, and because of this you then have to go through the what could this possibly be, how bad could this be. You have to, it's nerve-wracking to do so, and at the end of their treatment, when they come back into, they're let back into training with the first team and whoever they're training with, they'll be nervous about that. They'll definitely be anxious, because what if it happens again? They'll definitely be they'd be scared and anxious of re-injuring themselves. Then is lost confidence. So their session back, they won't have played for ages, so they won't know what they're still able to do. They'll be nervous about re-injuring themselves, so they won't be able to perform how they could. They'll be tentative about pushing themselves if they could re-injure themselves. Then lack of motivation again. So you might, the individual wouldn't be motivated to get back into training. If they're depressed, then they won't have the motivation to get back into rehabilitation. They won't be motivated to push themselves to actually keep to any regimes or rehabilitation programs that they have been given. Then it's fear, so that's the moment of diagnosis and possibly in their first game back. At the moment of diagnosis, you don't know how it'll be, so as well as being anxious, you would definitely be scared, because you could be out. That could be career ending with some injuries. That could do anything. That could be literally anything. You don't know. Then with denial, it's immediate. So you injure yourself and you're going, oh no, it can't be that bad. I'll walk it off. I'll strap it up. Just do whatever you can and I'll keep playing. But it might not be that simple. They might not be able to continue playing. Then isolation. So you're not involved in the team, and when you're not involved in the team, you can't train with everyone, you're away from everyone, you obviously will feel isolated. You won't be able to see everyone. Obviously everyone will be supporting you, but you're away from everyone and you can't do what you're used to doing, so you'll definitely feel denatured to the position you're in. Next are the 4 responses to treatment. These are the 4 stages of rehab treatment. So it's anxiety and stress, and these can help you in that it can fuel your ambition and you have knowledge for the future. But obviously, if you're anxious, you'll lose sleep. You might think that the injury is worse than it is, or it could be very overwhelming for you. Then it's frustration. So you can understand the severity through it, and you'd be eager to get back, but you'll lose motivation. You could give up completely. It will lead to isolation when you're frustrated and you can't do everything you used to be able to. With motivation, you'd be excited to get back. It can speed up your recovery time. If you stick to your program, and obviously with an injury, you'll come back. You feel that you could definitely come back stronger, and you'll see the bigger picture in that. You could, however, when you're over-motivated, you could push too hard, you could rush your recovery, and you will re-injure yourself. The 4th and last one is goal setting. So with the SMART target, so it's specific and everything. So as long as it's reachable and it's agreed, then obviously you'll know what you're doing. And you can, with goal setting, you can understand the injury better through stages of what you're going to do. You'll do this week, then a couple of months after doing that over and over again, say you strengthen the area, you do this. But again, with some athletes, they can set unachievable goals because they want to push themselves so hard. And if you don't do that, it can be down-putting. It can put you down. You don't know what you're doing. If you push it, if you set yourself a goal and you don't achieve it, obviously that's going to be destructive. You're not going to be able to continue like that. Next, the psychological strategies. These are imagery and goal setting. imagery where you picture the injury that you, or healing from the injury that you do have.